Dr. Morrell, if I saw you in 2005 and 2007, when I was diagnosed not once but twice with triple negative cancer, how do you counsel a patient like me or someone that's watching
I love
today?
that story. I love your story because as we've indicated, this is a type of cancer that can reoccur. That's what aggressive means. It can grow fast, and it can be quite difficult to treat without all of these tools. And this is probably our most exciting, latest area of progress in breast cancer because we learned about the targets for hormone receptor positive for 25 years. We learned about and got a tool for the HER2, and we were sitting with the triple negatives and said, chemotherapy, when you had it, that was sort of all we had, and now we have had a huge breakthrough with immunotherapy, and for the first time in my 30-year career, this is also a disease that we can plan to cure. And I think the one good thing in the answer to the question here was, because this is a fast-growing tumor, if it's going to come back, it's going to come back in the first 3 years, and by 5 years, this is not going to come back. So the good news is that we do have much more confidence that this is completely cured now at this time as a result. It also is, as you've indicated, Dr. George, a more genetic, and so every woman who has a breast cancer and is triple negative is now advised to undergo germline or genetic testing to see if this is an inherited form, because there are targets in the BRCA gene that we can also use medication for and prevent it from recurring.
You know, that is very exciting. As a cancer survivor, I remember for both of those cancers, they were kind of like, well, live well, see you at your next checkup. So to hear that so many advances have happened, thank you for sharing that with all of us. The most difficult cancer to treat, though, is late-stage disease when the tumors have metastasized or spread to other parts of the body. Let's hear from Megan, a stage 4 breast cancer patient. She's a survivor who is actively learning how to navigate the twists and turns of this condition. Listen to her story.
Hi, I'm Megan. I was probably 29 at the time that I started getting like a weird pain in my chest that wasn't normal for me. And I had a lot of barricades trying to get to a doctor. I didn't have insurance at the time. I didn't have a doctor I could go to. So I finally saw one, and they kind of dismissed me because I didn't have a family history of breast cancer and because of my age. So it took a long time for me to finally go to another doctor and get diagnosed. But I was diagnosed at age 30 with invasive ductal carcinoma. I went through chemo, double mastectomy, radiation, reconstruction, and then I was living blissfully, no evidence of disease for like 4.5 years, thinking, you know, cancer was behind me, and then I felt a pain again, which ended up leading to a secondary diagnosis. So I have metastatic breast cancer, or stage 4 breast cancer, and people don't know how to support you when you're stage 4 because they go, you might need a wig, or you know, you might need a meal train. But when you're like, I'm gonna need support for the rest of my life, I don't even know how to communicate how to support that. You know, I'm still trying to figure it out. And even when you don't have stage 4, cancer is a life sentence. You don't get to like just say, I'm over and done. You're always getting a test. You're always keeping it in the back of your mind. Because me keeping cancer in the back of my mind is what is making me be so well now as a stage 4 cancer survivor. Because I noticed my signs and I said, I have to go get tested. Something's not right. When it comes to work-life balance, I can't work full-time because the disease is where it is. And also, like, my participation in clinical trials, like, there's no 9 to 5 that would be like, yeah, take every other Tuesday off and, you know, every other month take all this time off for tests. But the thing, I don't, like, hustle at jobs anymore, but I do, like, hustle at time with the people that I love. And I do prioritize that. And even my husband could definitely work more days of the week, but we're like, you know what? Like, time is our currency. I'm metastatic, but I could live a full life. Like, I'm hopeful for that. What I can do is I can prioritize time with the people that I love, and I don't think no matter how much time on earth I have left, I don't think I'm ever gonna be sad that I made that decision for myself. Now I might not have all the money in the world, but you know, I am prioritizing happiness, and I am happy at the end of the day.